Hey, Ashley, how are you?
I'm good. How are you guys?
I'm good. This is Brian. This is Kevin. This is Ashley.
Hey, Ashley.
We're all one big happy family now.
We truly are.
Is it Ashley Ley or Ashley Leigh?
It's Ashley Ley because I'm not a whore. I'm just joking. I am a whore. I'm trying to fix the light in my room, but I guess that doesn't matter, right?
Yeah,
this isn't on video.
Audio. It's just so we can see each other.
What is
Oh,
this?
we got a guest already.
The hell?
We've got an interloper, and
Yeah.
you have like a J.J. Abrams like flare across the
so we
screen.
got a J.J.
Camera
Abrams
flare.
lens flare.
Yeah.
We're gonna use that video as evidence for this guy staying in my house without paying rent.
Ooh.
I'm just kidding.
That's right.
That's what we call in the rap game a scrub.
Welcome to INS, the International News Service, your source for the most important weird news from across the globe. With news analyst Kevin Harrison, actor, comedian, and musician Mike Wiebe, and professional commentator Brian Camp. INS, the news you need.
So, welcome to the International News Service. We're your hosts. I'm Kevin Harrison, along with...
I'm Brian Camp.
And I'm Mike Wiebe, and this week we have special medical correspondent Ashley Sharma.
Nice.
Yay! Clap. You know, I guess we always clap a little bit, but it is a weird because we're a news service and we like our clap, like like Brian.
You guys gotta bang pots and pans. That's the requirement.
Yeah, that's true. That's what Bryant Gumbel would get when he would have on Wilford. Who's the guy? Who's the guy? The old
Wilford
guy that would drive
Brimley,
around.
what are you going to say?
Well, yeah, I mean Wilford Brimley. That's a celebrity guest.
Old guy that we drive.
Yeah.
Oh,
Maybe
you're
that's-
talking about Charles Kuralt.
Charles Kuralt.
Yeah.
He's been reduced to the old guy that would drive around. Your folks are very upset with you right now, Michael.
He had like a multi-decade affair with a woman who was just with him when he was on the road.
That's so fucking cool.
He's on the road a lot.
Yeah.
Do you know who Charles Kuralt is? So this is a theme that comes up in this podcast a lot, is that we're all old and we don't and we have obscure references that are for nobody. This podcast is
Charles
for
Kuralt. Is he like Justin Bieber? I don't understand.
He's like a male Irma Bombeck.
Yeah. This is awesome. Charles Kuralt was a dude who had a segment on what news show was it?
It's like 60 Minutes or the
60
Today
Minutes
Show or something.
And he just like drive around America.
Good Morning
and it was
America,
just like,
I think.
he's like this. I'm an old white guy, and he'd be like, look, here we are in Happensack, Arkansas, where old 90-year-old Mrs. Eloise Kerfuffle makes the greatest pancakes anyone's ever had. And guess what? She's never lost a baby tooth. And some weird shit. Like, it was just kind of this like slice
I feel
of
like
life.
I've woken up in the living room and that was playing on my TV at like 3 a.m. And then I went,
Yeah.
yeah.
Right.
I feel like I would love that though.
It was, very romantic way to think about living life. Just town to town, meeting old broads.
Sleepy old people that are just on the brink of death.
Yeah.
True.
They've got old, she still can't walk from scarlet fever.
Right.
They've got the repercussions of diseases that have been what's the word I'm looking for?
Eradicated.
Eradicated. I was going to say
Yeah.
eviscerated, which is a much more violent choice.
That too.
That's
a lot
pretty cool.
of
really got
Americans
him.
are trying to bring those back, okay?
Yeah. Oh my
Right.
God. They really are. That's horrible. How stupid are we?
I don't know.
If vaccines didn't adversely affect brain function.
Yeah. On that note, you're wearing a shirt that says pro-choice.
This shirt
How
gets
does it feel to know you're going to hell? Oh no, it's weed.
Yeah.
Never
There's a lot
mind.
of drugs
Right.
in there. There's
Okay,
poppy. I see some pills.
I honestly don't even do drugs, but my friend designed the shirt and I was so nervous maybe I shouldn't. Well, whatever. I was nervous to show my parents and they were like, we love it. We want one. And I was like, tell me what you think is on the shirt. Well, yeah, I was like, what do you think is on the shirt? And they were like, a pipette and like a little mortar and pestle, and didn't get what the shirt was about. And I was like, it's about drugs. And they were like, it's cute.
It does look like they could be villains in a Super Mario Brothers game. It's like cute, cute
it's
villains.
like really, it's a really cute design. And I was nervous to wear it out. And then I was like, why am I nervous to wear this out? It's just very
Austin.
Cute.
Yeah, I think they're fine here.
I also don't think anyone's going to try to fight me.
Imagining a strung out Koopa right now.
Yeah.
Needle.
Needle in the arm Koopa.
Well, you know, and you can be pro-choice and not actually use any of those drugs. It's just a stance. So you're very supportive of
anyone can do whatever they want. At first I was like, well, it's all like, you know, there's no like fentanyl or anything on here. And then I was like, there's pills, but
those are probably
I'm not going to overanalyze the cute shirt.
Those are probably Oxycontins, I'm sure. Those pills.
That's melatonin. That's a B vitamin.
That's an ibuprofen.
None of these are anything that could have fentanyl in it, because that I'll be against. But you can do whatever you want. That's my main.
Do you see a lot of? So I guess I should introduce it.
Yeah, we gotta.
On top of a hilarious comedian, Ashley's also a nurse.
Yeah.
Was there more of a title in that? In your profession?
Nope, not really.
Nurse.
I'm just a regular old RN.
And that stands for right now.
Right now.
I thought just regular nurse.
Because I don't live in the past or the present or in the future. I'm living right now, and I have no medical training.
And what hospital can you be found at? So
people can. I'm like,
avoid it.
There's going to be a different podcast about me being a nurse. In 10 years for like a true crime thing.
Those are hot. That's what we probably should have done with this.
I know.
This would be the chilling early confession to being some sort of angel of death. Then this would be like the misplaced laughter at the idea of you.
Claim she did have medical training. How was this allowed? How did she get away with it for so long?
All these patients keep dying in a hospital, and they have the same nurse.
Yeah, and it all leads back to this one girl. There's so many, like, I don't know how anyone got away with killing anyone in a hospital, because there are like a million systems now that stop you from killing someone on accident.
That's why I never got into medicine.
Because you're afraid of killing someone?
No, because I'm afraid of getting caught.
Oh.
That's right. There's way better ways to kill people.
I was going to say, that's the least, that's a bad place to...
You should try a knife.
Yeah. Have you ever heard of a good old fashioned? I'm going to lose my job over this podcast. No, I was a standard like critical care nurse in a hospital. I graduated in 2019 and then was like on orientation until like January 2020. And then for 2 months, I was like, I think I can do a really good job at this. And then COVID happened and it was really bad. And so I did that for about 2 years doing like COVID critical care. And then I got really sick of being in the hospital and being in what was essentially end of life care. And now I work kind of on the opposite end in preventative care, working as I'm the nurse on a mobile team that works with chronically unhoused people who experience chronic medical issues, chronic mental health issues, and suffer from a substance abuse problem. And
probably some sepsis abuse problems.
Yeah, there's a little bit of each.
Yeah,
that is super
cool.
But
I just get to go I work for this really incredible doctor in this new program where you just get to meet people where they are, because it's a weird thing to expect like chronically ill, homeless people to be like, yeah, we can help you if you can come to this office at 3:00 in 2 weeks. And I sure hope you remember.
Yeah.
Catch you then.
Yeah.
Right. Yeah. Just put on your day planner.
Yeah. Just take out your
Do you have a Panda planner? It's a Panda planner. You open it up, has stuff to do their days. It says, what are your gratitudes? What do you want to do better?
Oh, you're not bullet journaling out here?
Yeah. Totally. It's a bullet journal. Where do you go for that? Do you go to camps, or is there kind of like just an area it's like gas, or like a church parking lot in a certain neighborhood or something?
Kind of everywhere. I feel really lucky that the program I work for is kind of don't take no for an answer. I mean, if it's within the limits of our where we're allowed to work, where I'm allowed to practice, we go there. And for some people, that's to qualify for our program, you do have to be homeless at the time. You can't be like housed, but maybe about to lose housing. You have to be experiencing chronic homelessness. And so we're like a housing first program. So we try to get people housed as quick as possible. We have like a housing specialist. So sometimes it's, meeting people like at an apartment or like a respite center or a shelter, anywhere we can get them housed. And then for other people who, due to whatever circumstances, we can't get housed, that'll mean like under the bridge or in a camp or a parking lot or just wherever we find them. Sometimes we know what stores they hang out at and we'll go pop around, say hi. I feel lucky to be able to do that because I know a lot of other people work jobs where they're like, man, I wish we could just go out there and help them.
Yeah.
And I'm like, I got to just say yes. I got to hop in my car and go, let's go find them.
This episode is already more uplifting than every other episode we've done combined.
Well, I'm going to bring it down real soon.
Right.
Oh, if you ask me the specifics and the reality of what that job means.
Well, I've definitely never done anything that intense, but I did have a job for a while where I worked with like mentally ill population for the county, and my job was to try and get them like they were people that all had housing, but they were like on the brink of losing it. So it was like trying to like, and we had like a little budget for them that they could like we could pay for them to like live for like a month or two, but we were supposed to get them work within that month or two, like help them find work. But they were all like schizophrenic as fuck, and on top of that, they were getting like SSI from the government. And if they were to get a real job, they would lose that SSI. But the SSI also wasn't enough for them to cover like rent in like the most, like the most ghetto apart, like this area called Concrete City and wasn't it called Concrete City?
Cement City.
Cement City.
Yeah.
Cement City.
It used to be. And it's nice now.
And is it really?
Yeah, they kind of fixed it up.
Yeah, where there's Denton talk, there's Denton, Texas talk. So it was like this weird like catch-22 of like there was no like get them a job and then
not too much of a job,
but you're supposed to get them a job because the money's going to run out. And also like what job is able to like, accommodate the needs of like some severely under-medicated, just like drug addicted. It was just this thing of like, there was no way to, and I burned out really, really quick because it was just like, and it was like a shit ton of paperwork to like do nothing, like to achieve absolutely nothing. It was just days of paperwork. And it was so, I just kind of, I was actually working there on 9/11, I remember, and I like had all this stuff to do, and then and like we had in the break room there was like TV in there. I don't know if you remember 9/11, but
I don't know. I was like, I was in the first grade.
Oh my god! But we were.
God damn it!
Yeah, well, we were. It was the towers were coming down. I was like, you know what? I think I'm done today. And they're like, what? You can't leave. You got paperwork. And I was like, I
think it'll be.
Yo, I've had enough of a day. I had a guy tell me he was going to punch me in the face because I might be a Satan worshiper. I'm gonna blow it off. So when you go out there, is there just how do you blow off steam when you're like, I did everything I could, but this guy or gals, there's got to be some people that you're just like, this just is not going to get any better, and there's no way it's going to get better. How do you mentally wrap your head around that?
Honestly, what you just described, that job does sound kind of similar to a lot of what our team does. I'm just on the medical side of it. On the, how can we get them to, regularly take their meds? Yeah. And what I've learned to do, it's like a huge learning curve because ICU was kind of like, you're here. If you need a scan, if you need to see a doctor, if you need to take this med, like it's probably going to happen. Even if, if people refuse things, sure. But for the most part, they're like, oh, you want to get the scan or you have to get the scan. We just roll you down the hall. Yeah. So most people won't say no to it. Whereas, out on the streets, it's like, okay, in 3 weeks, we need to get you there and back, and you can't eat all morning. Like, it's like a little bit different. It's a lot harder. So people will just refuse it. And that's frustrating. It's like there's a million barriers all of a sudden. But the way I like take it, the program I'm in is very new, and it's like a new model of healthcare, but I'm lucky that I'm in it because our model is kind of just to meet people where they are and not try to pressure them if they're not ready yet. Okay. So we just kind of get to be like this gentle, constant pressure that may not cause a change right away. And, we've had people where for, a year, they're not taking their meds. And so if I go see someone every day and they have a lot going on, they don't have housing and they don't have money and they're dealing with a lot of things you just talked about, and they don't want to take their meds, part of me is like, well, of course you don't, because why the fuck would you care about taking your medications when you don't know where your next meal is coming from? Right. So my goal is to just like focus really small and be like, okay, so if I've come every week for 4 months and not once has this person taken their meds, what else has changed in that time? Do they at least know what they're taking that medication for? Mm-hmm. Do they know why it's important to take it? Like, if someone is like got high blood pressure and they don't want to take their blood pressure pill, a lot of times when you first start showing up, you're like, you got to take this pill. And they're like, I don't want to. I have no clue why I take that. I don't know what it treats. And so like in 4 months, maybe they're still not taking the pill, but I can be like, do you know why it's important to take this? And they'll be like, well, high blood pressure can cause a stroke. And if I have a stroke, I may not be able to work anymore, or I may not be able to eat independently. And I'm like, that's something,
Yeah.
That's something. And it may take another 4 months for them to even remember to take it one time.
Yeah.
So I just got to stop getting in my head like, oh, I got to get this person to take their pill right now, this week, because I understand that they need to take it. And instead be like, from their perspective, they at least now understand what the medication is for. And that is progress.
Yeah.
You got to focus you got to zoom way out and then go, okay, I'm not going to get to the end goal this week. I need to zoom way in and maybe see how far I can get.
Now, Mike mentioned that at least at his job where it sounds like he was one of the principal players in the attacks on the World Trade Center.
Yeah, that's what I'm glad that you brought that up.
Did you hear? I mean, I'm not the one who heard that, but he mentioned that at least one of the people he was trying to help out thought that he was the devil and might hurt him.
Yes.
How often? And I don't want to make an assumption, but I'm assuming that you are sometimes threatened in your work because you are not, these aren't people coming to you. You are coming to them. Yeah. Many of them have made an intentional effort, maybe not to seek help. Mm-hmm. Are you ever threatened? Is there a risk to your life and limb?
And can I say that I did not have nothing to do with 9/11.
It had nothing to do with the first plane, but the second plane was almost all
right.
Well, nothing with the planes. I mean, some of the improvised explosives.
Sure.
Did I sell some plans and some devices at some point?
Right.
But I don't know who bought them, and I don't know where they went.
Now INS has an FBI file. Thanks, Mike.
You folded the dollar to look like that the first time.
You figured it out.
I've got an idea.
Yeah.
You showed that to some guys, and you don't know what they did with that.
I love the idea that the fold came first.
The fold came first?
Guys, I folded this dollar bill and hold on, I have an idea.
This gave me a crazy idea. Yeah. People are always saying Bush did 9/11, but it's more about the fold came first.
Yeah, it was somebody involved in origami for sure.
Yeah. I forgot what you asked because I started making fun.
Do you ever get threatened? Do you ever get any people who want to punch you in the face because there's whores of Babylon walking around? No, I was driving this guy and he was just like, this girl walked by. I'm driving him and he's like, look at her. Look at these whores of Babylon, these daughters of Mammon. It makes me so mad. And he smashed he was in the passenger seat, smashed the dashboard. I was like pulled over towards the side of the road. I was like, he's gonna hit me in the face, and I want to be sitting here when it happens.
I want to be off the road for that. Yeah. I mean, that's like kind of the big thing is like just recognizing, because to answer your question, yes, I have been threatened. I will say, I think people think every day I'm out there like fighting for my life, and some days it feels like that, but for the most part, when they're my patients and they know me, they're all really lovely and so accommodating and very protective. I've had someone, more often than not, someone who doesn't know me, like just another person will just see me out there. I have like this ridiculous giant backpack. It's here. I can't even pick it up. But I think other people see me and kind of be like, approach me like, what the hell's your deal? But the people who know me are so sweet and protective. However, they do, like I said, suffer from some pretty extreme mental illnesses sometimes. And sometimes people break. And you know what? I get it. And anytime that anyone goes, I don't want to say crazy, but like has a really extreme break, it's happened enough to where I feel like I'm pretty calm, because there's like three things that are going to happen. I'm either going to go, oh, I recognize they're getting angry before they even start to get really angry. And I can either de-escalate it or leave, or they're going to get really mad and we're just outside. And I'm like, I'm going to just leave this situation. But it's all about like kind of how you were saying, setting yourself up for success before it even happens. Someone's starting to get mad. I'm not going to like huddle myself in a corner, hunker down and be like, all right, let's, take out all the sharp things from my bag and say, let's chat. If someone's starting to get agitated, I'm going to like, try to de-escalate them while I've got my bag on, make sure that I've got a clear way out of there if I need it. And try to just de-escalate in the moment. But if not, just be like, all right, I'm going to go and I'll talk to you later. I'll come see you later and just leave. That is my big move. They love to threaten me, though. I've gotten that. There was one time I was at kind of the home clinic where I store my supplies, and someone knew I was there and came and was like threatening me outside. And I went out there with like water and snacks and was like, hey, bud, like, I got some snacks for you. And they were just this person was really angry and was like pointing things at me and threatening me. And the staff at the clinic was like, we got to call the police. And I was like, no, this person is just like this. They're going to come back in 5 minutes. They're going to want these snacks. Yeah. And really enough.
What kind of snacks were they?
Yeah, this is important.
Goldfish, the little crackers with. You
can't stay mad on goldfish.
And then those pack of 2 cookies that are like soft. Like when you think of a snack cookie, you think hard.
Oh, like moss cookies? Like those soft ones?
Mm-hmm, the soft,
like soft baked.
Otis Spunkmeyer?
Yeah.
Oh, those are good cookies.
Really good
right,
cookies.
Mike. Yeah. Those are good cookies.
I get it. I've had like a headache that is where it's like over in an hour, but it's made me mad for 3 days. Like I'll be in a grumpy mood just because I'm hungry.
Yeah.
Half the time these people are outside. The world is like, the odds are stacked against them. It's fucking hot as shit out there.
Yeah.
And I'm like, I bet you're fucking hungry and tired and in a bad mood. I might threaten somebody if I was in that bad of a mood. And then sure enough, the very nice person calmed down and came back and said, Tell Ashley I would like those snacks. And I was like, I got them right here for you, bud.
It's like those Snickers commercials where
you're not
Barbara Billingsley turns into, like the refrigerator Perry. Those names are not very current. Those are not too current. That's right. I referenced the mom from Leave It to Beavers.
The fridge is dead.
From Leave It to Beaver.
Wait, what are the 2 characters you said?
I just said when Barbara Billingsley becomes the refrigerator Perry.
You are.
I know, it's a little dated. They're dated. I called it. I'm the one that pointed it out.
She was in Airplane.
Oh, she was in Airplane.
Yeah,
she was the mom on Leave It to Beaver, and then
okay, I know Airplane.
For the Chicago Bears for like 2 years.
I love that you both said Leave It to Beaver as though that's a cultural touchstone everybody knows. Leave It to Beaver.
I know what Leave It to Beaver is.
See?
Okay.
Do I know all the characters?
Yeah. Mike? Do you know the dad's name?
Larry Mondello. Do you know Larry Mondello?
Beaver, right? Is his name Beaver?
The main kid's name's Beaver.
Yeah.
And he's got a brother named Wally.
Just died.
And his dad and mom.
Her parents hate them?
Ward and June.
Eddie Haskell. The parents do not. They don't like Eddie Haskell. He's a real conniver.
He's a real alfalfa type.
And then there's the forgettable one's name is Larry Mondello.
I don't remember him.
That's the forgettable one's name?
Yeah. He's just kind of a dum-dum.
Yeah, he's not around very often.
Yeah.
You guys ready to get started with these stories here?
Wait, what do you mean, Kevin?
I want to talk more about Leave It to Beaver.
Okay, well, they did bring this series back. There was an 80s reboot called The New Leave It to Beaver. And initially, the pilot, everyone was divorced, and it was real sad. But then they brought it back to a regular show, and it was like the full cast except for the dad, Hugh Beaumont, who was dead, and they had a bunch of kids, and it was fairly likable. Spent a lot of time watching. It was a syndicated program.
But didn't the Beeb grow up to be kind of an asshole? Like I feel like Wally had the better life.
I'm sure.
Well, yeah, I mean, Beeb was a pud. He was like a real...
Yeah.
He was a pod?
Yeah, he was a fucking... I'm a fucking dub.
Yeah.
Wally seemed pretty cool.
That was droopy.
He was kind of droopy-ish.
That was a good droopy.
And there was an episode where one of Beaver's kids found Fantastic Four #1. Ooh. And then they put it. The last episode was Beaver going to a bank to put it in a safe deposit box, and right as he's putting it in, he opens it up and sits down and reads it. And I remember even as a kid going, "You're ruining the value of that, you dumb son of a bitch."
Wait, so that's when he was adult though. That was
adult. That was in the reboot.
Yeah.
So he has kids. He doesn't have a wife though.
She's dead.
What?
His wife was dead.
Was the wife a character in the original Leave It to Beaver?
No. Because he's a kid in Leave It to Beaver, and then on the reboot, his wife's dead.
How much of a kid? Like 8?
5 probably in the
yeah, I think he was
toddler.
like 5.
Yeah.
Well, not
No,
5.
he was not 5.
I don't know how old kids are. He was probably 8.
He was 5.
Probably 8. It was probably on 5 years. So 8, 9, 10, 11, 12. He might have even been 13. He got real like that thing where
older.
you watched him grow up, and there was like that year where it's like,
why were they leaving anything to Beaver? He's a 5-year-old.
Oh yeah, they didn't. He was a real.
I looked it up. He was 8 when they started filming.
And then how long? I mean, seasons did it have?
They had 6 seasons. It was canceled in 63.
14.
Which was the year, I believe, Fantastic Four #1 came out.
Mm-hmm. 2 years before 9/11.
No, that's not right.
After Mike's big... Or wait, 2 years before?
That was 2 years that Mike was fermenting his hatred of the United States.
And you know what really got me into it is because I watched the episode where Beaver, in one of the later seasons, he rejoices when Kennedy gets killed in 1962.
Oh, you know what? I think I have seen that one.
You've seen it. Yeah, see, you've seen it.
Yeah, everyone's seen that one.
He goes, "Death to capitalism."
Mm-hmm.
That classic Leave It to Beaver line.
Yeah.
I watched Alf.
Oh, Alf's...
Tell us about that.
Alf has come up every week on this podcast for the last 3 weeks.
You guys just give off that Alf energy. The three of you combined are big.
Yeah.
Wait, hold on, Mike. Do your Alf impression for us.
Well, it's not Alf. Oh yeah, no, it is Alf.
Yeah.
It is Alf. This is what Alf says. Willie. Really good. Talking to Willie.
You have to talk about eating the cat.
Yeah. Okay. Hey, here's why Alf came up. You know why Alf came up?
Why?
Because Willie, the actor that plays Willie, his name's Max Wright, and there's pictures of him shirtless, smoking crack with male prostitutes.
Mm-hmm.
He sounds pretty freaking cool.
I mean,
no. Why? Who took that picture?
I think I don't know.
That's a good question.
I don't know if it was someone trying to blackmail him or like this is pre-TMZ. What was it? National Enquirer is what the people that.
Oh wait, it. Not a recent picture.
Maybe like.
Yeah, I mean,
Alf was already canceled though, right?
Yeah. I was like 15 years old, 18 years old.
Okay, I was like, I thought it was like now, and I was like, how old is this person?
Well, he's probably still doing it.
Once you get a taste for crack and male prostitutes, it's hard, you know.
Yeah.
What do you think comes first?
Well, I mean, depending on how good the male prostitutes are. What? Hey!
The way you're saying male prostitute is like how people say like male man. Like, it seems like you're just assuming that all prostitutes are women unless you specify.
Oh.
Like male man versus male woman.
Thank you.
Thank you.
I'm gonna high road this. Thank you for saying that.
I'm actually I was starting to prepare a rebuttal, and I'm
not gonna lie. I don't know what my stance is because I don't know what I want.
Yeah,
that's true. Well, yeah.
Yeah, I mean, I don't know the numbers. I do assume that there are more female prostitutes than male prostitutes if it's a numbers game.
Yeah.
But I don't know. I might, you know what? I was preparing a rebuttal and I don't actually have one. I don't have the facts
You don't have the evidentiary support to make a rebuttal.
I mean, those are a bunch of words that I'm just going to agree with.
That's right.
I learned the term evidentiary support from Legally Blonde. So,
okay. Yeah. I know that movie.
Good. Well, certainly when the story came out, and by the way, not the same guy as Mr. Drummond from Different Strokes, but when the story came out,
not the same guy.
It's not the same guy.
Just bringing
It
up
was the fact that the prostitutes were male made the story more salacious because it did come out in like the 90s, I think. Right?
Yeah, it did.
And that's why. Oh yeah, it's not a recent story at all. No one needs to know about.
I bet it was the 2000s that it came out.
I think
like
it was
Alf
the
was
early
good,
2000s.
far and gone.
But what else? What did he do after Alf?
They're just the male prostitutes.
He was in Snow Falling on Cedars. He was in Grumpy Your Old Men. He was in A Midsummer Night's Dream.
Play Puck. Probably not.
I know Midsummer's Night's Dream. No, Puck. Puck is the fairy.
Yeah, I'm to the listener. I'm putting up my hands as if there
He's
should be
doing a total fairy thing right now.
Well, they have like he'll have branches taped to his hands, and then I'll like put them down. And go,
this is theater. We're hearing from Theater Mike right now.
Well, Theater Mike, I do listen. I did not go to medical school. I went to something a little bit more important called theater school. While Ashley can individually work on people to save their lives, I can perform to many people and save hundreds of lives.
You make life worth living.
Did you ever see my performance of You Can't Take It With You?
Are you asking me?
Yes.
No, but I'd love to see it now.
I can't. It was about 19.
High school.
I was in the 90s.
I was there for the 90s. Well,
it was a high school production that I was in.
Mike played xylophone.
You played xylophone?
I did play the xylophone in it.
Dude,
yes.
I got to tell you, the people that played xylophone, those were the cool kids.
Well, I'll tell you, the only thing I learned was the chopsticks and the Close Encounters theme song.
Oh, that's cool.
Oh, of course. That's all you play. Those are the only two xylophones.
Well, those are the only two worth playing. Oh, I can tell you how Alf came up in my life recently as well, because I referenced how when men get cold, their genitals are smaller.
Oh, got it.
And my wife said, yeah, and it looks like Alf.
Looks like Alf if you're lucky.
And I was like, I don't.
I feel like it most of the time doesn't look like Alf.
I've never seen one, so I don't really, other than.
Your own?
Yeah.
So you guys ready? Oh, sorry.
Kevin's trying to cut me off because I'm.
Kevin is so desperate to get started.
Yeah. Oh, are we not started?
Yeah, we started.
No, we started, but now we're going to do that. We're actually going to do the news stories. These are medical stories that we're going to need your advice on.
We will need your expert medical opinions.
Yes.
Oh, perfect.
And commentary.
I can do that.
So this week is our special medical oddities episode.
Mm-hmm.
So if you're a little squeamish, then we've got a real treat for you. We've got a special guest, comedian and nurse Ashley Sharma. Then we've got 2 medical stories, and then we'll explore some of the deep, dark secrets of what nurses see. I said your last name. Is that okay or not? Because you're a comedian.
Oh, that's fine. Okay. I started comedy a month before nursing, and I was like, nothing's going to come of this. And now it's sometimes a problem, but, we're too far in.
So our first story comes to us from the 2018 volume of BMJ Case Reports.
Legitimate news source. Yeah.
The best volume, some would say.
This one will have a visual aid, by the way. Yes. In the past, we have covered strange things found in people's stomachs. But what we haven't covered up to this point is things found in rectums. Specifically, things that got stuck there.
I damn near killed them.
Can we do that again so your timing's not a sentence off?
No.
This is about right.
Yeah.
A 31-year-old man in Milan, Italy, showed up to an emergency room with a 23-inch or 60-centimeter dildo lodged completely inside him.
Mamma mia!
That's not even shocking.
What?
I guess this length is shocking.
Almost 2 feet. Right.
We'll have a visual aid in a minute. Don't worry.
Oh, good.
What could the visual aid possibly be?
Well, we'll get to that. The man explained to ER staff that the toy was not removable by hand and had been stuck for 24 hours. But other than some mild abdominal pain, he was feeling fine.
What they said, he said it's not removable by hand. Was he like, you're gonna have to use your mouth?
Yeah, no, I was gonna say that's what I was also expecting him to say.
I mean, he might have said, I didn't see that, but
But he would have said it like this. He would have said, you're gonna have to use your mouth.
So I'm going to show you an x-ray, but I'm going to tell you, like, it literally looks like he has a dick running into his heart.
Aw. I don't know why I said
I don't, that was a
yeah,
concerned
so
sound, or
cute.
like, oh, this is going to be cute. This is
I
going to be
just
gay.
heard dick and heart and was like, aw. I gotta say, just before we even see the picture, there's like no way that going to the ER to get it removed wasn't his specific kink. Because you got a lot of time where you're like, this is going too far. 2 feet, that's like a lot.
So you already think that when he even started this, the idea was he was going to end up in the ER.
Whoa.
Where it would be like where you would, it's kind of starts off with a normal, where you would expect a dick to be.
Yeah.
But it runs all the way through his chest, up the left side. And yeah, where I would.
Well,
think his
no,
heart was.
if those are his hip bones, then his heart's way higher than that, right?
So you're thinking it's running
That's
through his
still
lungs.
That's his tummy area.
He's definitely, it's kind of hard to tell because it's like so zoomed in, but that must have perforated something.
Yeah, I was about to say, did that perforate something?
Yeah, but it's,
Because I can use, I use words like perforate too.
You say
'cause I'm
perforate
also-
all the time,
You're
Mike.
using
Yeah,
that word.
it's
One
I'm
thing
not
about Mike,
medical.
you just say
Because
perforate.
I'm medical.
And for the
Or-
listener, when you say perforate, what do you mean?
punch like a hole.
Okay.
Ooh.
All
If you
right.
put it that way, it's really scary.
Yeah,
Like-
but then it's like he was, other than mild abdominal pain, he was fine. So maybe it just like really bent his intestine, like he's just going really weird into his intestine.
Is that a serious medical issue if you perforate your,
Yeah.
I guess that's your colon?
So I've had, I can't go into detail, but I have had a remarkably similar case before. And it was like, it's like a long, because they don't know exactly what the surgery is
feet.
going to look like, but they like plan for like a big, long procedure for that because it could cause so many issues. It can cause so many different bowel issues. And a lot of times if something is stuck up a rectum like that, they will have to get like a colostomy if it's done enough damage. And that can be reversed in some cases. Other cases it can't, but it's like, that's like a big deal.
Yeah,
Yeah.
It sounds like it damn near killed him.
Yeah. And it was, and you know what he said? I think I've read this, and on the record, he said it was worth every inch.
Oh no.
Do you have what is your dialogue like with someone? Are you fairly just like, I'm in the room and doing what it needs to be done? Or is it
Just on time for the rectum story.
Look who
Hey, everybody.
we start saying the
Hey,
word
Mark.
rectum and guess who shows up.
Conjured him up.
Exactly. You say the word rectum 3 times and he appears just like Beetlejuice. Listeners, producer, man behind the boards, the man with the plan, Mark Ryan is here. Mark Ryan, meet Ashley. Ashley, Mark Ryan.
Hi, Ashley.
Yeah.
Sorry to interrupt. Don't mind me.
No, you
We
came
just-
right in time.
We were just talking about when things get so far shoved up a rectum, it damn near kills them.
Every time.
It's like a problem.
So what you're looking at is a 23-inch or 60 centimeter dildo shoved entirely up a man's ass.
Well, why do they make them that big anyway?
For fun.
So the medical team tried multiple approaches, including snaring it with a wire loop and dilating the man's rectum with a balloon and then grabbing it with forceps. Unfortunately, these failed due to, quote, the rigidity, the smoothness, and the size of the object. Facing the possibility of very intrusive surgery, the medical team created a new instrument. They took a loop of surgical wire and pushed it through a stent tube, so it made kind of an adjustable lasso.
Yeah.
like a dog catcher uses.
The lasso is a common thing. They use that on a smaller scale. Maybe
Okay.
not that big, but yeah.
So the new tool was rigid enough that it was able to grasp the dildo and pull it from the man's colon walls. The doctor in charge of the team said, quote, "We suggest this new technique as a valid option to remove large foreign bodies from the colon and rectum when standard endoscopic methods for foreign body extraction fail. The man was released the same day with no lasting problems beyond his embarrassment.
I don't think he's embarrassed.
I don't think he's embarrassed either.
I stand by it that I kind of think that's what he wanted.
Yeah.
The article did say he sent apology notes to the entire medical staff.
Oh, okay, then maybe not. Or maybe that plays into
Maybe
it.
it just adds into the shame that he wants to feel like that.
Yeah.
You know?
Yeah. That's the kink.
Mhm.
When you get someone in there with something lodged, is there a typical demeanor, or is there a typical psychology that you think you see in these folks?
Like, are you asking if the person has a certain demeanor, or are you saying that like
if they have a certain like
a weird walk?
Imagine they have a weird walk.
or like, well, no, I mean like if they're like I don't know what happened. I just sat down and the next thing I knew. Or if they're like, no, it was Labor Day weekend, and
Right.
that gets
it's one or the other. Honestly, those are the two kinds of people I've encountered, are like people that are like, I don't know, I just got this, champagne glass all the way up there, and it's like, you do the x-ray and it's like intact, and you're like, I don't think that was an accident. Like, I don't think that they'll say like, I don't really know how that happened, I just fell. And you're like, there's no way, that makes no sense. Or it'll be like people that are just like, yeah, we were doing this, and have like very little shame about it. Both is fine. I understand both perspectives.
How common is this?
Pretty common.
Like a nightly occurrence, weekly occurrence?
Probably at least weekly. At least where I work, there's something, all the time.
Now, do they get to? Do they like, hey, we pulled it out. Do you put it in a baggie and they take it home, or does it?
I believe
is it incinerated?
From a similar situation that I was in, we did not return it, but it was also a repeated issue. And it had been there for a while. So
yeah,
what does a while mean?
10 days.
Oh my God.
Yeah.
So are there people that it's like, you keep doing this and it's starting to, well, I mean, I guess they got to pay for it at some point, right?
You got good insurance.
But I guess no, if you're going to the ER, like you can't turn away like a person in distress, right?
The hospital I worked at, we did not turn away people who couldn't pay. We would take anybody, and which is a beautiful thing. But also we would kind of get people that the term is frequent flyers, for people that you see repeatedly, and like
they get miles.
Miles and miles and miles built up in inches for some of the people. We'd get kind of frequent flyers of people that would do things so regularly and so uniformly, where it's like the same situation every single time, to the point where we were like, yeah, we know this is on purpose. And that would be not just things up the butt. There's some people that would come in for the same thing like every 2 days.
Like what?
Also swallowing things, shoving things up their rectum, shoving things inside of their genitals.
Oh.
That's a thing.
Oh yeah, big time. All sorts of stuff.
What kind of stuff?
Cement.
What?
Staples.
What?
How do you,
like, wet?
Do they mix the cement and like it?
Like taking a block of cement and crushing it down, and then taking pieces and.
Oh wow,
that's very specific.
Wow.
I will say, all three of those things. The reason I chose to say those three things is that is not one patient, one occurrence, not even one hospital. That has happened multiple times at multiple different hospitals.
So you're not pinning it on one person. You're not revealing anything.
No,
you
it's like, see, I wouldn't say anything that is like, oh, there's only one case of that ever.
Yeah,
right.
No. Yeah. Everything I've mentioned, like is glasses, like any sort of like flute or glass, that is a common one.
That one, and I've heard that a bunch of times. It's not from people, but just over like. So is the fear has got to be with the glass stuff is that what if it breaks?
Yeah.
In there.
If it breaks, that's a huge issue. But I would say of the many times I saw it, it would not often be totally shattered.
How does it not break though? I mean,
it would be sometimes it would be cracked, but the real it would be cracked so where there's and that's a little bad, but I don't think I'd ever had one where it was totally shattered because that's super. That would have been a whole issue.
This would make a great ad for Waterford Crystal.
That's so funny.
It's so strong that.
So when you're in these scenarios,
you withstand anything.
What is your job specifically?
Oh yeah, nurses normally do everything, right?
Are you the one with gloves and a pair of pliers going trying to get it out of there, or are you handing stuff to docs, or what are they, assuming it's not a surgery? Or what? And also if it is a surgery,
if it's a surgery, then I would usually be there to help with the initial assessment and talk to the patient about what's going to happen. Once they decide what they're going to do, I'd be there for signing consent. So here's what's going to go down, and have them sign it. And then they go off. I was never an OR nurse.
Okay.
And so I would never be there during, if it was a surgery.
What if it was a removal?
If it was just a removal, I was there for a lot of it. And in fact, when I was a student, that is when you get the most action, because I got a little bit of a reputation as a student as if there's something weird, get me in there. Get me in there.
We need an example.
Any sort of lancing, lancing something with a high pressure, where there's going to be pus.
Mm-hmm.
Yeah.
Oh, loved that. Anytime there's a bug in
Have you
here.
had pus hit your face?
No, I'd wear a face shield, but I loved learning the process of that. And that is not something that all nurses will do. It's more of an advanced practice thing. But with the doctor right there, and if I said I wanted to do hands-on, they would often let me do it. I literally would love to. I'm so disgusting. Any bug in an ear, so many bugs in ears.
Really?
Bugs in ears so many bugs in ears.
What's the biggest bug that you saw in an ear?
There was one time where it was an alive bug, and it was the most bizarre thing I've ever seen in my life, because it was it was almost like they had worked in they must have worked in construction, but it was almost like they had coal or something pressed into their ear. And the craziest thing was the bug was alive. So we cleared out, we irrigated and cleared out the dirt. And then we saw that there was a bug, but then it was getting freaked out by the light. And so you'd put the light on and off, and it would be peeking its head out and then going back in and then peeking. We ended up having to kill the bug, and kind of bummed me out. I was there's got to be a way that we can save it.
You hear that you take that pledge of do no harm, but
you
got to do. And then you're so afraid, because if there's part of the bug still in there, we have to kind of reconstruct the bug and be is there any leftover bug in the ear?
Now, when you're deciding between killing the man and killing the bug, did you have to go in front of a death panel and let them decide?
It was, we did a vote in the room, and it was close. But man won out because he got a vote, and he was the one over.
Was it the earwax was so thick the bug was able to kind of hide, or?
He kept peeking. It was the most bizarre thing I've seen in my life, where he was kind of going. And I was what am I looking at right now?
The guy know he had a bug in his ear?
Yeah, he knew. He knew something in his ear. He was having tons of pain and balance issues, and he was feeling all off. He had tons of stuff in his ear. His ear was packed up.
Do you think he had a thing about putting shit in his ear? Was that
No, it was clearly a work situation.
Okay.
Yeah, it was. That person was caked, and they were clearly coming from work. You can sense a weirdo. I've got a good weirdo radar.
How many weirdos do you sense right now? I'm just curious.
Oh, I've got 5.
Yeah, well.
And if you would believe it, I'm not one. Mike is counting it's 2.
We knew that.
Hey.
One for each time.
I have more questions, but maybe Kevin, should you do the next story? Because I'll kind of save them for the end.
This story is pretty recent too, so it's pretty exciting.
Okay.
So this comes to us from the June 2022 edition of the American Journal of Case Reports. The article didn't make it clear where this occurred, but a 72-year-old man showed up to an emergency room recently with a number of health ailments, including a whistling scrotum. When doctors examined the man, they determined that both of his lungs had collapsed, and as a result, air was circulating freely through the man's chest. The man also revealed that he had surgery on his scrotum a few months earlier, and doctors found a wound where the air would escape. So what doctors think happened is that the air built up in the man's body and then escaped by whistling out his scrotum. Doctors describe this as unusual since there are a handful of reports of scrotums filling with air, but nothing about them whistling. The man spent 3 days in the hospital where the air was drained from his chest, and he was treated for collapsed lungs, given antibiotics, and had a procedure to close his scrotal wound. But real quick, I also want to point out, so this article had so many scrotal x-rays of this man that I swear to God, I've seen his dick more than any other dick I've ever seen outside of my own or porn.
I'm wondering, could he perform the theme from Bridge on the River Kwai?
And that's actually what he came in performing.
Yeah.
So I revealed patient-specific information.
See you in court.
He could just do the theme to Taxi.
Or Leave It to Beaver.
Well, you guys, I don't know if you know this, Ashley. I actually have collapsed my lung before.
Yeah.
I believe that because did it just happen spontaneously?
No, I fell off a bar.
Oh, well, then that's completely, forget what I was going to say.
Yeah, it was blunt force trauma. I fell off a bar. And you know what? I was able to do a nice little ditty with my Prince Albert piercing. No, I don't have a Prince Albert piercing. I did not able to whistle or sing through my genitals, but I did collapse my lung once. I wonder how this. A lot of old people it'll just collapse on them though, right?
Right. Yeah.
No, well, I thought the direction I was going in was that really young people that are tall and thin.
Oh yeah, go on.
And really handsome and No, that's like a common thing is that like young people, like really young, like 18, 19-year-olds will have a spontaneous lung collapse because of just like the build of a tall, thin person. Sometimes it just happens. But did you get a chest tube?
Yeah, I got I'm not going to put my shirt, but I got they stuck a tube in here and I was in the hospital for about 5 days while it was draining and I have a thing and stuff like that. But
a big canister, right?
Big canister. Yeah. This weird fluid. It was, super, super weird. Yeah, it was awful. It was truly, truly, truly awful.
It sounds like and Ashley, correct me if I'm wrong, but it sounds like if this is something that happens to lots of people who are tall and thin, that from at least an evolutionary standpoint, science has kind of gotten in the way of eliminating tall, thin people from the earth, right? Like
modern medicine is standing in the way of short people rising up. Well, not rising up, staying to the ground.
Right. Right.
Or tall, thin people are evolving to no longer need lungs and simply exist through taking our oxygen through the light.
I love that.
Like a breatharian.
I want to empower you to be the first person to try.
Light doesn't have oxygen.
I did try, and there was a fucking world that threw me in a hospital.
That's painful.
Stuck tubes in me.
Chest tubes are painful. Were you out when they put it in?
No. I went to it was South by Southwest, and I was doing a show, and
I think you were saying that's the hospital, and I was like, that's bad.
I can confirm that 4 of the people here were at that show.
Oh, everyone was here. And so I was like, but whenever they always say like, when you break a rib, it's like real painful and there's nothing they can really do about it, So I was like, wow, I think I probably just broke it. First I was like, I need to go to the hospital. And then on the way home, I kind of was like, I don't know, let's just go to the house. And then went back to the house and I got real high and drank a bunch because I was like, well, that'll make it feel better. And then I went to bed and I woke up at like 5 a.m. and was like, it's still hurty. My girlfriend or fiance at the time was like, let's go. And I was like, I don't have good insurance. I got to figure it out. So I was like trying to do, how fun it is to figure out insurance shit. And I was trying to do that. And so then I went to like one of those pop-up ERs and, they were like real like, yeah, what do you want? You know, like, what do you want? And then they don't really care or anything. And they wheeled me back into a thing. This real surly lady wheeled me back into a thing and did X-ray. And I could see like through the like glass kind of things. I could see her like look at the X-ray and get like kind of like get real serious looking. And she came back in and she went from very surly to very nice and courteous and prompt.
You could take that out of your.
That's when I knew shit was not good. And I was like, what's wrong? What'd you see? And she's like, the doctor will tell you in just a moment. And I was just like, you tell me. And so then the doctor came in and was like, you collapsed your lung. And because I like always go to the worst place, I was like, they took a thing and I'm just like riddled with cancer. And so, which I don't even know, but so I was like, lung collapse. Marky Mark was fine in Three Kings when that happened to him. He like put a big tube up. Yeah. So they gave me some fentanyl and they put a tube up in me, but the fentanyl was pretty, I see why there's an addiction to that stuff. It's pretty sweet stuff.
Yeah, when I worked on like a post-surgical unit, people do love it a lot.
They get hurt on purpose to get it?
If they were, I mean, we weren't giving it for baby stuff. Well, maybe as we were, but you know.
Baby stuff.
Now I feel like I'm going to get judged if I ever go to the ER.
We're judging you. I say that's like a joke I always say about like, people think like nurses have seen it all, they're not going to be phased, and I'm like, we're not phased, we are judging you though. Like,
yeah,
you don't think we go in the hall and go, this one you see? Well, actually, I'm super nice and I'm nice all the time at work, and I've never said a single mean thing ever. No, I will, unless the kind of person that I will maybe be like, bro, stop, is when it's like a young man with nothing wrong with him, where he'll be like waiting for test results and they're so mean. Oh, really? Is that you guys? It's you. I'm looking at the face of
no, I feel like I was pretty.
You were nice?
On definitely that occasion. I did get a little like, I didn't have enough power, but I wanted to argue because they were like, and it's one of those little pop-ups, like the one over by Buzzmill, like the little pop-up ER
like
things.
ER things.
And I was like, they were like, okay, well, we got to get an ambulance to take you over to the thing after they put the tube in me. And I was like, no. I was like, I'm not going to drive, but my wife will. And they're like, no, we got to get an ambulance. And I was like, no, I can't afford $1,000 for a 4-mile drive. And they're like, too bad. And I started to get a little. Not irate. I was just, I started to argue, and then I was like, this hurts too much. Whatever. I'm just going to go ahead and.
I don't mind if someone's like in pain. I have a pretty high tolerance, I think, for people. I've never thought one of my homeless people were bad. I've never thought, for the most part, no one has annoyed me except for when dudes, like young, like 30-year-old dudes, are mean to their wife, or even worse, their mom that's with them, and they'll be very nice to the staff and like horrible to their mom. I'm like, I'm gonna kill you, which is maybe that's not nice, but still, it's you're an adult man, and most of the time when they were mean like that, if you have enough energy to be mean to your mom, you're usually fine. They would often come back with like music or whatever.
I can see that.
Real quick about the scrotum guy though, real quick. That guy, two collapsed lungs. You have no lungs left. He must have not been whistling for long before they fixed it. That must have been a quick tune.
Yeah, you only have 2 of them, right?
Can we say this? That he was whistling "Dick Me."
Oh, Michael.
You know what? Though I do have a question because that doctor, the ER guy that put the thing in there, he was a real goddamn weirdo. And then the main lung doctor lady she was great, but she was almost like you. If you told me she was an android, I would have gone, yeah. Like she was just he was a robot. And the more doctors I run across in my life, the less seem like human beings. Like how many doctors, and this might be sensitive, but I'm not asking for names, obviously, but like, do you find that a lot of doctors are like weird automaton people?
I will say this. the doctor I work with currently is maybe one of my favorite doctors of all time. And like the community health doctors I work with are incredible.
Yeah.
Some of the surgeons
more that I'm thinking more surgeons.
Yeah.
Insane. And specifically, every pulmonologist, which is like a lung doctor that I've worked with, that's like a very critical kind of doctor. Usually when I worked with a lot of like, we call them PC3A doctors, but like they're like a lung doctor. I worked with them a lot for COVID, and they're all brilliant. If I was ever dying, I'd want them there. But also they were like a little insane. But I think that comes with having so much knowledge and responsibility. How could you not go crazy?
Yeah.
But they're all very particular, especially surgeons are so particular and yeah, they're a little crazy.
It did seem like I had fucked up my hand real good a long time ago and had to get some real surgery on my hand a couple times. And those guys, I remember the guy was just like, and the lung lady too. It feels like you traded your emotions for knowledge.
Or maybe I've seen doctors that are like so one way at the hospital or clinic or wherever. And this is like the kind of perk of comedy is that when doctors find out you do comedy, they want to come see it. And I hate that kind of. Yeah. And that's really the only time that my last name being the same for comedy has been an issue for me, is that like sometimes doctors will be like, I looked you up and I'm coming. And they're like so insane and serious in the hospital. You're like, I do not want you anywhere near my stupid comedy show. You'll never respect me ever again.
Yeah.
And then they come to the show and they're like the biggest, wildest partiers. So fun. So like lighthearted. Do not talk about work at all. But it's like in the hospital, they're like, which is also crazy. That's still crazy. It's just a different kind.
Yeah, to be able to compartmentalize things to that, even your entire personality for that much time a day. That's,
Which I get. I mean, if you're doing that kind of work, I can't.
Yeah. I mean, that's probably a reason why I could never be smart enough to do that kind of work, is compartmentalize. I mean, not only smart enough, but also like the emotional intelligence to be able to separate all that stuff is probably something I'm not capable of as well.
Well, I feel like nobody does it right. I feel like everything I described is not people who are being very emotionally intelligent necessarily. I think they're just doing their best.
Yeah.
And B, I feel like I have always been pretty true to form. I think all of my bosses, like nurse managers, have seen me do comedy for the most part. And all like most of my coworkers have seen me do it. And no one has ever been like, wow, I had no idea you were like this. That's like, I feel like I'm pretty much the same on either side. And boy, has not compartmentalized and kicked my ass sometimes. Because if there's just like no line and I'm like, I'm just all me all the time, it'll just kill you. It'll just suck the life straight out of you. And you're like, damn, maybe I should have put up a wall or two.
Yeah. Oh, this is what I want to hear. Top wounds, worst wounds you've seen.
Worst wounds, multiple. Yeah. I'll give it a whole genre, because there's this one. Wow. There's this whole thing that you like learn about in school that I guess, and I guess it's important to note that I had no medical experience before I was a nurse. Like sometimes people are like work in hospitals or nursing homes or are like a nurse's aide or medical assistant. I was just like I worked at like an escape room and a soap shop. Like I had not. A hotel. I had done lots of jobs, none of them remotely medical. And so in school, you learn about pressure wounds. And in my head, I was like, I'm not going to see, how often am I going to see a wound from pressure? That's not going to happen. Like, or maybe if it does, it's going to be very rare, which is a pressure wound is like, if you like sit still for 15 minutes and you're feeling that urge to shift, like off of your like bony prominences, like your tailbone, or if you're laying down, or like your shoulder, or your elbow, if you lean against something for a while and there's like that red spot on your elbow, that's your body like telling itself to shift to avoid a pressure wound. And for
like a bed sore?
Yeah, like a bed sore. Okay. Exactly. And so it'll come from like the pressure of your bone and the weight of your body on the bone, like rubbing against your skin. And if you don't have the ability to shift, so it's really common in people that are disabled or like paraplegics or quadriplegics or people with less feeling than usual, they won't have that sense to shift off of it. and it will just sit, and that pressure will just literally cause the gnarliest, deepest tunneling wounds. So in the hospital, especially in the ICU, you have a lot of patients that have decreased feeling. You have to like turn them every 2 hours, like on the clock. You go in there, you reposition them. You have like special pads and things to remove the weight to keep them safe. And that's good. And then they don't get the wounds. Mm-hmm. In like nursing homes, they don't do that. In nursing homes, people are left for hours and they don't get shifted or turned. And what happens is they will stay there for weeks and they get these horrible wounds. And so someone will like change, there'll be a little wound and they'll put a Band-Aid on it. And then that person will lay there for God knows how long with nobody turning them. And I'm not blaming the staff because these ratios are set up to make the staff fail anyways, but that's besides the point. And then they'll have like a heart condition or something that gets them to come into the hospital. So you'll get a patient and they'll be like, oh, so-and-so is from a nursing home. They have this heart problem. And if you turn them and you see like a bandage on their back, oh my gosh, like 80% of the time you open that thing up and that bandage hasn't been changed in weeks. And it is the most horrible wound you've ever seen. I've seen some that have gone down to the bone. And it's the thing is, it's that like the genre of wound I'm giving to you. It's like from a nursing home, hasn't this bandage that is not labeled. You don't know how long it's been on there. And you peel that off the first time. That is the worst kind of wound. I've seen like bugs and maggots, things.
That's what I was leading up to. I want to hear about maggots.
I've seen maggots a couple times, and it's in exactly that kind of wound where unfortunately these people are left in these nursing homes.
Oh man.
And are just people aren't able to turn them. And
what's the smell like? Is there a smell?
There is a very strong smell.
I'm gonna guess Dracar Noir.
It is. They don't turn them, but they do spray them, and it's sad, but it is a little sexy. No, I'm just kidding. It's always sad. It's not sexy. I think I'm used to the wound smell, though. I think there's worse smells.
Wow. What is a worse smell than a wound smell?
I think most people are in agreement, like most medical professionals, like bloody stool is pretty bad.
Okay.
Really?
I'll say that C. diff, which is a specific kind of bowel disease, is pretty gnarly. And people will be able to say like, oh, that's C. diff. Like they can smell the difference, but they can't. It's proven that you can't. It just smells bad.
C. diff.
What about a cat? Could a cat or a dog smell the difference? Because that happens a lot.
I don't think so. I think it's proven that like people just think they know. There's going to be C. diff dogs where they're going to be like, yeah, this dog can smell C. diff, but no.
Oh yeah.
Oh yeah.
If you ever hear anyone in medicine go, I can smell the difference between normal bloody feces and a C. diff patient, they're lying. There's studies against it that say
smell the C. diff.
It's just a coincidence. But yeah, C. diff is the kind of bacteria that causes that kind of unfortunate bowel pattern. But that's probably the worst smell. Maybe a lot of people would maybe argue it's the wound smell, but I'm really used to the wound smell. And my favorite thing in the world is just when you find a poor patient like that is to clean it up really nicely and bandage it up. And then hopefully it begins to heal. Sometimes it doesn't, but at least you know it's clean.
Yeah.
Yeah. It's a nice feeling. It's a bad feeling when you're doing it though, because they're in pain, but you know.
Yeah. My last question is, have you had to be in the room when you lost one? Have you ever had to be around a dying patient?
All the time. Really? Many times. Yeah. For COVID, that was a big part of it. For COVID, the doctors would go in sometimes, maybe for like 15 minutes max a day, if that. Physical therapy wouldn't go in. It was really just nurses going in. No family was allowed. And then we'd lose a lot of patients. I probably lost count of how many times I was in the room with a dying patient. I have like a really depressing notebook somewhere that has like all the last This is a horrible way to end.
Well,
I know.
yeah, it is. It's my fault.
may
But
cut this
I will
question.
say, you are always in a posy mood. You're one of the most positive people that I'm around.
Right.
Yeah.
That's crazy.
You had positive energy this whole time.
I know, and
Did
you're-
you just think that she was going to make a joke about it, Mike? Did you think you were going to, like, this was going to, she was like, yeah, as a matter of fact,
No,
you wouldn't
listen,
believe what this one
halfway,
person
we
said.
might cut this, but halfway out of my mouth, I realized this was a bad question to end on.
I'm so
staying
sorry
in.
that I was really like, that was a depressing way to end. But it's, you know what? At the end, to stay true to what you said, at the end, there's some days where I'm like, why did that matter? Because I didn't want to be in there, and the patient didn't want me there. They wanted their family there. So like, who was it for? Who did I help? And then they died. So it's like even the one person that you might have helped doesn't even remember. But at the end of the day, I like to think it's like that thing I talked about earlier where you look at the big picture and it's going to feel like you did nothing. So you have to zoom really small in and you have to go, if I was in there with that person and I had the privilege to be the one that held their hand or sang them happy birthday or like give them their last meal and just do whatever they want at the last moments. I feel lucky to have gotten to do that. So
Yeah.
Nice.
You're a better person than all of us combined.
You're a better person than the rest of us.
We're crippled by our
yeah.
own neuroses, let
Yeah.
alone like bleeding, sucking wounds on other people.
She never sucked any wounds.
well, I didn't say that I didn't.
Exactly.
Hey.
Wait a minute. Hey, what about snake bites? Let's end it on snake bites are fun.
Yeah, snake bites
You
are
ever get
fun.
the good snake bite?
I've never seen a snake bite in the hospital. I've gotten bitten
Damn
by
it.
a snake though, but
Oh, what kind?
I have no idea what kind. My family's from the Fiji Islands and we went back to Fiji and my dad took us on this little dinghy to Castaway Island where they like filmed the movie Castaway.
Oh.
And I was like little. So they took me off the boat first and were like, okay, you go play. We're going to unload. And we were they were just going to drop us off in this boat, leave and pick us up in like 8 hours. And in the like minute that they had me roaming around the island, I went and kicked a log and a snake came out and bit me.
Oh, wow.
And by the time I walked back over crying, being like, a snake just bit me, the boat was gone. There's no phones. And so my dad just picked me up and carried me around this little castaway island where we were legitimately stuck. And there was a Target photo shoot going on the other side. And they had a medic.
Oh, nice.
Wow. What was it? A poisonous snake? Yeah.
It wasn't poisonous. It was just a snake.
Still, you can get an infection from a snake bite, right?
I think I believe I did get an infection and I had to go to a Fijian. My parents have all these, whenever we went back to Fiji when I was a kid, I would get so hurt every time. I'd get like an infection or ringworm. I was just like an accident prone kid. So I would end up, they have all these pictures of me in Fijian hospitals. I think that's why I'm a nurse. To tie it all together, I think that's why, is because I just ended up in the hospital all the time as a kid.
Nice.
Yeah.
So, Ashley, where can people find you? Like, do you have any shows coming up? Do you have any social media?
I have my own show every third Friday of the month at the Velveeta Room. It's called Blackout. It's a fun little game and a show all at once.
It's in Austin?
It's in Austin, Texas, United States.
North America.
North
Checks out.
America,
Yep.
world. Well, this world at least. And then my Instagram is DAT_Ash. I made it when I was very young and I've stuck with it.
Nice.
I get it.
Yeah, because like that. Ash.
That ass.
Yeah.
So that wraps up another week of the International News Service. Find us across social media at International News Pod. Email us at internationalnewspod@gmail.com. If you're going to shove INS into your body cavities, then make sure it's your ears. And check for bugs before you do.
Check for bugs before you do.
Ooh.
Check out the INS merch store at Redbubble and our Patreon. We'll see you next week.
Bye.
Thank you for listening to the International News Service. Don't forget to rate, review, and subscribe to the podcast. INS, the news you need.